provide vaccination for free. That means that ministries of health commit their budgets to protect the population for free. So this also means that PAHO has been supporting member states with technical cooperation in building this structure to make sure that they have a financing scheme, that they have policies in place, and even in some countries they have some laws that acquisition of vaccines is only made through the revolving fund from PAHO. The revolving fund is a mechanism that PAHO has established as to make sure that we get vaccines in bulk because of the different sizes of the countries, but they say, okay, we're going to buy the vaccines through PAHO, so PAHO will go and buy vaccines and the producer will distribute directly to the countries. But this effort of buying the vaccines, we assure the quality, we assure that the vaccine arrives on time, and we assure that they get most of the times the best price available. And I say most of the times because there's some monopolies in vaccines that is very difficult to break, and that's a specific negotiation. But the traditional vaccines, as measles, as polio, as BCG, they're now so cheap that really investing such a couple of dollars to save a life of a child is really worth. And I think that's part of what PAHO has brought to the table, and that together with all the member states, we have achieved this today. And it was great news to have the news from the Committee of International Evaluation today in the main session of the Directing Council here in Washington.
So it is really a momentous day. The countries of the Americas have eliminated measles. And turning from the regional side to the countryside, I'd like to ask Dr. Delahaye, the Chief Medical Officer of Jamaica, how things went in his country. What actions did you in Jamaica take to achieve this measles elimination?
Sure, thank you. Well, our last outbreak was between 1989 and 91, when we had over 13,000 cases, and including 18 deaths. Since then, we started with what we call a Big Bang measles vaccination initiative in May 1991, followed by, in 1996, another initiative where we vaccinated those between the ages of 1 and 10 years. And it's a sustained effort that really highlights, that's the important thing I'd like to highlight. And then in May 2002, we started to routinely administer a second MMR to individuals between the ages of 4 and 6, which we later reduced to 18 months. In addition to that, in 1998, in keeping with the CARICOM resolution in terms of another campaign, we again did 8 to 9,000 persons measles, mumps, rubella vaccine. And then, of course, since then we added routine immunization of women of childbearing age, even post-delivery, who did not have evidence of having received the vaccination. In 2008, we did a follow-up campaign when we had a case of imported measles and vaccinated a number of persons. And then an ongoing review of our tracking registers to ensure that we were finding those who may have fallen, slipped between in terms of being vaccinated, and ensure that we follow up and administer. And then, of course, with the declaration of one confirmed case, we now consider an outbreak. So if we have one case, we consider that an outbreak and escalate our activities to match that. Again, we have a virology lab at the University Hospital of the West Indies. It's a teaching university. And for cases which would be highly suspicious, we ask them to do the testing even while we await the confirmatory result from CARFO, which is in Trinidad. We certainly hope that we'll get to the point where we're designated an official testing site for measles in the near future. So it's been that ongoing collaborative effort to include PAHO that has led to, in a sustained way, our ability to stay measles free.
I know the Caribbean has been a leader in public health in general and in immunization in particular, and I think people on Facebook Live will be interested to know that really you were one of the first regions to begin And I remember the campaign that you did in the Caribbean
Yes.
to make measles history. And really making measles history started, I think it was back in the late 1980s and early 1990s with getting rid of measles cases in Jamaica. So we've gotten rid of smallpox.
Right.
We've eradicated polio from the Americas for quite a few years now. Today we're declaring the elimination of measles from the Americas. What's next? What do you think might come next?
We're very clear that the efforts need to be sustained so it doesn't stay away. We must ensure that we follow up. So we're increased vigilance in terms of imported cases so that we can implement in a timely manner other efforts at vaccination of those who may have been affected. And of course, we're always ready to support any Caribbean international initiative in terms of campaigns to ensure that we stay measles free. And then, of course, working with our National Public Health Lab, as I mentioned, so that hopefully in the near future we can be designated laboratory which can confirm a measles case.
I see. I'd like to turn to Dr. Susan Reef from the Centers for Disease Control and Prevention in Atlanta, who has come to Washington for this announcement and for her close collaboration with the countries of PAHO and certainly the immunization program here. I know that you have been working very solidly on rubella and measles at the same time, and I know that CDC was one of the principal partners. Can you talk a little bit about CDC's role and maybe more generally also about what role the partners had in achieving this elimination?
Yes, I'll be happy to. CDC has worked closely with PAHO. I've been working closely with PAHO for over 20 years. So it's been my privilege. And we've worked with PAHO on a whole array of different activities. We financially support PAHO through a cooperative agreement, and then we also provide technical support. And that can be from participating in the national campaigns to helping to develop surveillance or evaluations. So it depends on what the need is for the country and for PAHO to what CDC can provide. As for partnerships, they are very, very important at all levels. Within the country, you look at the public and private partnership, which is very important because both of them can immunize children and adults, and also they can detect cases too. So we need that hand in hand. And in some of the initiatives, you could see that different ministries were coming together and different groups were coming together. Education, the vaccination in the schools, or OBGYNs looking at for rubella. So different partnerships were developed and paved because of measles and rubella. And then for a regional point of view, there are many partners and stuff that get together and work together to achieve the elimination. And then the global partners, like PAHO, WHO, CDC. So there, at all levels, there are different partnerships that all work together to achieve the goal.
I know PAHO has been considered a leader in the Americas in these regional elimination programs and eradication programs. But is CDC supporting other regions as well in measles vaccination, and do you potentially see support for measles elimination to start in other regions?
Absolutely. All 6 WHO regions have measles elimination goals, and CDC does support each region, all 6 WHO regions for measles elimination, and also they support them for rubella too. Mm-hmm. So yes.
Okay. And then speaking of rubella, measles, and mumps, I know that most people know that in the United States and in many other countries we use the measles, mumps, rubella vaccine, which is proven safe and efficacious. Mm-hmm. Have our efforts been hurt at all by controversies or false claims about by anti-vaccine people about vaccines causing disease or causing autism? Do you think that's something that few people believe now, or has that gained some credence among vaccine hesitant people or vaccine deniers?
I think that's a great question because even though the studies have been debunked and basically there's no supporting data to prove that, I think some people still believe it. But I think it's starting to prove itself that there is no, that it was false. It was a false statement. And I hopefully you can see in England that they were able to start to make ground. And that's where a lot of the issues started with Andrew Wakefield. And their vaccine coverage has increased. And so hopefully we will continue to see it to increase. As for in the United States, it was the working together of the partners, trying to ensure that our immunization coverage stayed high. But you're right, it's always something that we have to look at and deal with head on, and give the facts.
I know that WHO has a new initiative on vaccine hesitancy, because previously I think people thought that anyone who thought vaccines were harmful was crazy or kind of far off or out of the mainstream. And now, do you think it's more important to take these people not seriously, but to understand the reasons why there might be vaccine hesitancy? And is this kind of an ongoing program in states as well in the U.S.?
Absolutely, it is. We need to understand better why they're hesitant and what the issues are to see if there is a common theme or different issues. Was it religious, philosophical, or some misunderstanding of the science? And then to address those issues where it's at. I think something else that's very important is that many of the parents today don't know what measles or rubella or other diseases look like. And so they worry about the adverse effects and the issues there, but they don't realize what the real disease looks like and that it continues to kill. I think it was very important that WHO has stated that there's over 100,000 measles deaths a year. Kids are still dying of a disease that we just eliminated and declared eliminated today. So I think we need to deal with them and understand better what the issues are.
If you allow me, David,
I was going to say,
I think that
please
this is not only this kind of groups which go against science and all these things. There's also this small group of parents that they believe that because they live in a high income group and they live in a nice neighborhood, their kids would never get sick. And we have to remember that viruses and bacteria do not need passports, or do not need income, and they will pass from one person to another. And that's pretty much what happened in the outbreak in California, in Disney. There was one person who came from Asia and found a group of people who were not vaccinated, and the disease started to spread out. So I think that when you ask many parents why they don't vaccinate their children, some of them will say, yes, I'm against vaccines because they can create this kind of issues in my kid or whatever, which is really, we would have many, many thousands of cases related to vaccines that we don't have any. That all vaccines cause autism. Probably all these in this table were vaccinated at one point or another. We don't have any autism. But these fears that some groups are passing around, they get engaged in many populations, and it's not good. But also, they think that I live in a nice neighborhood, I will never get sick, my kids will never get sick, therefore I don't need a vaccination to vaccinate them, is not true. For instance, just for people to understand in Facebook, vaccination is like having a small neighborhood, and those at night everybody closes their doors, but some of people don't. So there's a thief coming, and they start trying to open the doors. Those doors that are locked are the ones who are vaccinated. Those doors that are unlocked are the ones where the thief or the virus can come in. So the virus will try to come into all the houses. So if the virus comes to a child that is vaccinated, it will not go in, and the child will not get infected. But if the virus finds a door that is open, meaning not vaccinated, the virus will go in, and that will cause the problems that we are facing as children with many problems getting to the hospital and hopefully not dying, but many die. As Dr. was saying, 100,000 deaths a year still from a preventable disease by a vaccine.
So as we see, measles is not just a rash, but it's really a deadly disease, and it also causes other health problems apart from killing kids, doesn't it? Can you tell a little bit more to people who might be watching on Facebook who need to know why they should vaccinate their child against measles? What else does measles cause?
They can have
And rubella as well.
I can tell you measles, there's kids that die from the diarrhea in developing countries. They also have pneumonia, so those other complications. And there's a rare one called subacute panencephalitis where they die from, but it's very rare. Mm-hmm. For rubella, I think what's very important is that, as you know, for rubella, it's the pregnant woman that's the issue in her early pregnancies. If she gets infected, she can have a baby that's deaf, blind, and have heart disease. And these babies do die. And so, or what we also note for the most part is that they live a life not being able to hear, they're deaf, they might be blind, or they may have heart problems. So they live their life shortened, but they live their life many times not able to have a quality life at all. So both have very devastating effects.
So I think the bottom line for all of us, as you probably would say in Jamaica, is go for the gold and get vaccinated.
Yes. And keep at it.
And keep at it. How long, Dr. Becerra, do you think we will have to keep up until we are able to eliminate measles worldwide? Is there any way to guess how long it might take?
I think this is going to be a long run. So it's going to be probably longer than a marathon. So we just finished the first part. Now, a real challenge comes to all the countries to sustain the good level of vaccination, of coverage in all areas, urban and rural, as to make sure that all the children are vaccinated. That they keep on going, keeping vaccination between 90-95%, to make sure that even if there's an imported case coming, there might be a lot of very few people infected, or probably non-infected if we have 100% coverage. Mm-hmm. But this is going to be for quite a bit of time. This is the first region of the 6 to eliminate measles. So we know that other regions are also working, but probably not as hard as PAHO has worked, as this region has worked. So we know that there's going to be probably next January at WHO, at the World Health Organization, some member states will bring a proposal of resolution to set a date for eradication of measles in the world. That setting the date is expected to be taken in 2020. So by 2020, they might say, okay, by 2050, by 2040, every country in the world will aim to eradicate measles. But until then, we have to keep on working, we have to keep on vaccinating, and we have to give thank you to the member states and partners like CDC, the Red Cross, keep on working very, very hard.
Right. And it is a feasible goal, isn't it? Because isn't measles only, the virus is only found in humans. There are no other carriers of the virus, is that right?
Yes, there was a conference here at PAHO that brought everybody together, and yes, it was determined to be feasible. And also, not only measles, but rubella. Both of them, it's feasible to eliminate or eradicate.
Together, using the same vaccine.
Yes, which is very important, yes.
Okay, well, I think we have seen with our experts here how important a day this was for measles elimination and for public health in the Americas. We want to thank you very much for participating from Jamaica, from the CDC, and from the Pan American Health Organization. I think we're at a momentous day, a historic day, and we're proud to have you with us today. Thank you.
Well, thank you, David. Thank you very much. And
thank you.
Goodbye, our friends in Facebook.
Bye-bye.
Bye-bye, measles.
Bye, measles. Right.